the mentorship through my Instagram page. Currently, I'm staying with my family in my hometown, Jammu, which is a small town in northern part of India, and I am also a proud dog dad to my 2-year-old Labrador.
Oh, wow, that's great.
Now, talking about my clinical experience, I got a chance to serve in various healthcare settings across my city in urban, suburban, and the rural areas. And also recently, I finished my 4 months of United States clinical experience.
Okay.
As a part of my volunteer work, I got a chance to serve as a state coordinator for Medical Student Association of India during third year of my medical school. And also, I organized and participated in various blood donation awareness and blood donation campaigns during my medical school and even after that.
Okay.
This is my professional life. Now, talking about my interests, I like during my free time, I like spending time with my dog and my two niece. Then I love cooking Indian food for my family and friends. Then lastly, I run an Instagram page by the name of Metstagram where I connect with 1,800 fellow international medical graduates. And on that page, I share snippets from my USMLE journey, answer their hundreds of questions every month. And also, I've got a chance to mentor 50 students so far through my page. So yeah, that's me.
That's very impressive to know about you, Ayushman. I guess you might have experienced everything all across various areas, I would say. I'm
Mhm.
happy to know about you. So tell me something about your strengths and weaknesses.
Sure. So the like three of my strengths are like I'm very adjustable because during my 4 months of United States clinical experience, I had to shift home every 30 days. So I was packing stuff every 30 days and calling a new place my home, in starting of a month and starting there from scratch. So that I feel that way I'm very adjusting. Secondly, I don't shy away asking for help from the people because I acknowledge the fact that I'm not a superhuman and still there's a lot to learn.
Okay.
And at the same time, I don't shy away helping out people in the best way possible. My third strength would be like my friends always say that I'm very curious. I just like exploring new places, new culture, and new foods as well. Plus, I'm very talkative, so I make friends very easily. So I'm an easygoing person that way.
That's great to know.
Yeah. So now talking about my weakness, so like the strengths I mentioned, they were a weakness at one point of time, but I really worked on that to make it my strengths. But one of my weakness is, the work-life balance. I just regret that during my medical school, I had to juggle between the medical school curriculum and my extracurricular activities. So I spent less time with my family at that point of time, and I regret about that. But as you grow old and you become mature, so you just realize how important is the family. But yeah, now I make sure at least once a day, even if I am at home, but I'm at work, I make sure that at least I call my parents once a day, and in that way, I just remain connected to them, and I try to make them special as well.
That's great. That's great. I really like the way you're working up your weaknesses and just making sure you just have a appropriate work-life balance. I
Mhm.
guess that is what the quality of a resident that we actually wish for as well. Okay. So coming to the next question, where do you see yourself in 5 years?
Oh, that's a good question. So, like professionally, I see myself successfully finishing my internal medicine residency and learning the different aspects of patient care from that, so that I can just manage my patients well in a hospital. So I just see myself working as a hospital in a hospital settings and treating my patients. Talking about my non-professional life, I just see myself finding the love of my life, probably we can marry to, right? And then I see myself exploring new places with my partner, going to new places, exploring their culture, their food. And thirdly, I run an Instagram page, and I have plans to reach out to more people so that I can grow my page. And also, I plan to start YouTube channel where I can share the medicine related content. Plus, I can try my hands at daily vlogging as well. So yeah, that's like I have my plans in 5 years. But again, I am open to new opportunity because I feel in every phase of life you learn something, and that might shape up my future plans as well.
That's great to know. That's great to know. So, as you have told about your Instagram page, so I would like to know more about it. Can you just tell me when did you start this page and how many followers do you have and what kind of content do you keep posting?
Sure, sure. So basically, Dr. Kash, I started that page with an idea that I want to help out people because I feel like in my life, when I reach out to people and like if I reach out to 10 people, even three of them respond and help me out, it feels very good. So I thought, why not reciprocate it and help out the people, those who are in need. So I started my page with that intention in last year in August 2022. I just got a chance to start my Instagram page and initially sharing the medical related content at that time. Just give me a second. I'll just mute. Yeah.
Yeah.
So I was sharing medical related content initially, but then as I was learning new things, I started sharing that like my OET experience, my step two experience, how I got my visa. And slowly and steadily, even I advocated for mentorship through my page and got a chance to mentor 50 students. And lately I thought that having one-on-one mentorship session is tough for me because I was working, doing a lot of things at one point of time. So I started having regular webinars on my page where I connected with 50 or 60 people at one time. So yeah, that's my small journey, and I'm so now a family of 1,800 international medical graduates on my page.
That's amazing. So I really like the thought of you guiding the younger generation towards this journey. Okay, so a few more questions that I have towards you would be like, do you have any research experience on your CV, and how do you find how did the research experience help you out?
So coming from a country, yeah, where research is not given that much importance, we just we are given more importance on the clinical aspect of the patient care, right?
Okay.
So I started my research journey very late, but yeah, that was something new to explore, and I loved being part of few projects. Like when I was working at Narayana Hospital, I was a part of Department of Nephrology, but due to the shortage of the medical officers, I was posted for 1 month, for 1 week in the Department of Gynecology. So at that point of time, I was just discussing about my USMLE journey, that I'm looking for research projects with my attending, and then she came up that she has an interesting case, and in that way, if I can help her write a case report and we can get it submitted and published as well. So through that, like I got one opportunity. Then after that, I was a part of few literature reviews and case reports more. And one of them was when I was at Brooklyn Cancer Care, there was a AMA, American Medical Association Research Challenge, and we submitted our two abstracts over there. One was the case report, which was the retroperitoneal HPV with the unknown primary,
Okay.
and the other one was a literature review, and we submitted both of them to the AMA, which got accepted as well.
Okay.
But still, I'm looking for the new opportunity so that I can be part of more projects, because that's how I'm going to learn at the end of it.
Sure. Okay, I would say this would be the final question. So did you ever have a conflict with a colleague, and how did you deal with it?
That's an interesting question. So, as I can recall an incident when I was working at a private hospital in my city. At that time, I was in my morning shift, and it was soon going to end. So I was rounding with my attending, and the attending ordered the CT abdomen of a patient for the next day. Since my shift was ending, so I just handed over. I had to give my handover, both verbally and written, handover to my colleague in the next shift, because we don't have an electric health record system in that hospital, right? So in that and during that day, it was a lot of patient load in the hospital. So next day I come, and the attending was a little furious at me because CT scan was not done. Then I confronted my colleague that when I had told you that to get the CT scan done, why didn't you get it done? Because the attending was furious today. So then she told that it was a lot of patients that day. I was the only doctor on duty. Plus, I haven't mentioned anything on the register, right? Then later on, I just checked the register, and maybe because I was busy, but I missed writing about the CT scan orders on the register. Then after that, my colleague, she was also my friend. She was upset with me that why I confronted her, because it was not her mistake at all. Then firstly, I just went and apologized to her that it was a miscommunication and it was my fault, right? Then after sometimes she was okay, and then we went to one of our senior doctors who used to look after administration, and we brought up the issue with her.
Okay.
And then finally we came up with an idea that because we don't have any electric health records system in the hospital, we just made a WhatsApp group where all the doctors on the duty are a part of, and we just immediately put the orders over. Like whenever we get the order, we just directly send it on the WhatsApp group. So that's how like it was a conflict, but I acknowledged my mistake and apologized to my colleague.
Okay, that sounds fine. Okay, thank you so much, Ayushman, for this wonderful interview session. I feel like you would be a great fit to our residency program, and we wish to get back to you soon as we can. It
Thank you
was
so
nice
much.
talking to you and knowing you as a person.
Thank you so much.
Yeah. So. Tatseen, I would say your the flow of your answers is absolutely good. So
Mm.
it's going on in a smooth pace and everything. And I guess I did see one comment of saying how to resolve a conflict with a colleague was a bit long, but I guess you made your point clear in that. I would say like just try to cut short a few points and you're good to go in that aspect.
I
And
can practice on that, of course. Okay. Hmm.
yeah, and I guess I did. I just had one more question in my mind, but I could just ask you about it. Why this program and everything? I guess that is very objective, and it varies from program to program. But
Hmm.
the way you just actually framed your answer for tell me about yourself is great, and I would my suggestion according to my expertise that I would say is like add a bit more two more points about your hobbies in the last paragraph to make the program director know more about you as a person. So that is my entire feedback on this, and remaining all seems to be golden, I would say.
Okay. Oh, thank you so much. Like I just work on the answers, like I'll practice it more, and maybe I'll just try to shorten it. The practice makes you perfect. Yeah, thank you so much. I'll just work on that. Thank you so much. Anybody else wants to quickly give a feedback? Then I can interview Dr. Akash.
Yeah, I wish I was
I
as ready as
I
you.
have some feedback for you. Um, so Ayushman, I'm sorry, I didn't really write everything down, but I think like there are a few points where you can definitely improve. Starting with tell me about yourself. You start.
Mm-hmm.
It's very long. It's very 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 long. We need to cut it short, and
Okay.
it's not coming in a flow. Like you taking pauses. Pauses is great, but it feels like you're done and but then you're not done and then you start again with like your journey. So all this professional life that you've added where you've done 4 months of USCE, this is redundant information. We don't need this. Remove that. Just
Okay.
say that you come from XYZ place. Don't say you're an international medical graduate from India. Just say
Okay.
you're Ayushman. That's it. We don't need anything else. And
Okay.
then like Dr. Akash said, um more about hobbies because that essentially humanizes you. And I think your again like when you started explaining about your Instagram page,
Mm-hmm.
maybe remove that you help international students. Just say that you help students in this
Yeah,
journey so
I'll
that
just
if
say
it's in
I just help medical students. Okay, perfect. Yeah.
yeah, that's great. Um, for your strengths, because the question was tell me strengths and weaknesses. You it became very long because the strengths were three strengths, so maybe like stick to one or two strengths and then like talk about weaknesses.
Okay.
Work life balance, I'm not sure if you should be using that as a weakness because I was advised to like just not talk about work life balance in any way, not even as your strength, weakness, or like as a negative aspect of medicine or internal medicine. So even though I tried to phrase it really nicely, I was asked to remove it completely. Maybe remove this line where you say that these were my weaknesses and I've made them my strengths because it's making it very long, and maybe just stick to two strengths.
Okay.
Strengths are fine, there's nothing wrong with the strengths and the content per se. For the conflict, I'm so sorry, I sort of zoned out, so I could not make points. But like Dr. Akash said, that there, you conveyed everything that you had to, so I'm sure you did.
Okay.
Um, Other questions I actually don't really remember. So this is like the feedback upper that I remember. So I decided
Thank
this
you
is
so much. Hmm. I'll just work on like what you
um,
told. Because many people gave me a lot of feedback on my tell me about yourself. I'll just work on that. Like I should be mentioning about I only help international medical graduates. It was just like spontaneous thing, yeah, but I'll be more careful
mhm.
next time if somebody asks me that I help medical students out.
Yeah, also there's this one point you said that India is not very heavy on research. Remove that line. Just say that you had research experience and talk about research experience
Okay.
because that's a little negative tone. What if a
Mhm.
program director thinks that so like, he's a guy who's never been exposed to evidence-based medicine. Is that something that we have to teach him or
Mhm.
is
Okay.
he like well knowledgeable? So maybe like remove that point. If you want, I can do a mock with Dr. Akash, and
Mhm.
maybe, or if like you want to go ahead, you can go ahead.
Okay, I'll just have a mock with him, then you can just go ahead. Like, it's fine if Dr. Akash wants to have it right now, he can just have it after this.
I wish I was as prepared as you guys, but Ria, you're most welcome to just go ahead. Go ahead. I'll just jot down a few points as well. And Ayushman, I would say you're doing pretty good, and I would say like you're almost prepared for giving an interview in the next couple of days. I would say
I am
so.
not confident at all, but yeah, I'm just practicing. See, practice makes you perfect. There are a lot of negative points that I have, right? Maybe like 2 days back, I didn't have that much confidence, but slowly I'm building my confidence. But yeah, I have to work on my answers so that they're not very long at the end of the day.
Yeah, so just fine tune them, I guess. So you can just cut out a few things, and I guess talk something more about yourself, I would say.
Perfect, perfect.
Apart from the clinical experience that you have focused on, try just making them into one paragraph so that everything focuses about your personal life and they'll
Okay.
get
I
about.
will work on that. I will work on that. Okay, perfect. Yeah. So just I would just that's just a small request that when interview is going on at that time, just don't comment in the chat box because that makes you a little nervous at that point of time and the answer like goes wrong. Like that happened with me. I I,
Okay,
I just appreciate your Ria. I appreciate that it's your comment like it's too long, but it made me a little nervous. So like we can just avoid that. Otherwise, yeah, you after the meet you're free to give your feedback because that's how we are going to improve at the end of the day, right? And it's very good, like Ria, you made very good points and I'll work on that. Thank you so much.
yeah.
Yeah, I'm so sorry for like
No,
writing it
no, no,
while
no,
you couldn't
that's
hear
fine,
me.
that's fine, it's absolutely fine. It was just like it makes you a little bit nervous, right? But I will have to work on my answers for sure, definitely. So yeah, I'll start with my mock. So Akash, it's 9:24. I'll go till
Mhm.
9:40, right?
Yeah, for sure. Yeah.
So hey Akash, how are you?
Hey, Dr. Ayushman. Nice to meet you. I'm doing good. Thanks for asking. How are you?
I'm doing good too. So I was just going through a lot of I'm going through your CV, your personal statement. It's very interesting, right? So
Yeah.
I would just like to know about your journey so far. Tell me what Dr. Akash is.
Okay. So, first of all, I would like to thank you, Dr. Ayushman. It's a wonderful opportunity, and I
Mm-hmm.
feel it's an absolute honor to be interviewed for your residency program. A
Mm-hmm.
little bit myself, I'm Akash, and I'm from a city, Hyderabad, from southern India, known for its vibrant nightlife and the food, especially. So I come from a nuclear family, and my father is an engineer, and my mom is a teacher, and my I have a younger sibling who's doing his +1 right now.
Mm-hmm.
Say like what exactly steered me to be a doctor was from a very young age, and it all started when I started dressing as a doctor for each and every fancy dress competition during my childhood.
Mm-hmm.
My motivation was all entirely solidified by my brother's journey with autism. Each and every step of his testament was a testament like what an impactful physician can not only
Mm-hmm.
on the patient but also on the family. These magical feelings of astonishment, hope, and relief, which I experienced from my brother's physician, actually inspired me to be a doctor one day.
Okay, perfect. Mm-hmm.
With all this, I just started my medical journey and I pursued my medical journey in Malareddy Institute of Medical Sciences, a prestigious institution in Telangana.
Mm-hmm.
As a first generation doctor from my family, I found the medical field very captivating. So I was very much interested and keen with patient care from since the day one, and I continuously sought through each and every knowledge possible to gain the most out of it.
Okay.
So I would say academically, I was involved in each and every part where I volunteered and organized several medical camps, organized several awareness drives. And culturally, I organized and participated in several events. And sports, I'm a huge fan of sports. So I'm an avid soccer player and a badminton player, and I've represented my college in I am a huge fan of Naruto, and whoever I've been talking with the residents and everyone, I guess anime was the chosen method to just went up their stress, I would say.
Mm-hmm.
And Yeah, so I even love cooking and doing art. And first year anatomy, where I was just trying to draw each and every anatomical picture, I would say those came out to be perfect, and I was the teacher's pet at that time.
Oh.
So, in conclusion, I would say thank you so much for this wonderful opportunity, and it would be an absolute honor to be a part of your residency program.
Perfect, perfect. So it's very interesting that you're multi-talented at the same time, Dr. Akash. So now
Oh,
I
thank you
just
so
want to
much.
know, like, how growing up in Hyderabad was for you. I heard about Hyderabad; it's a very interesting city. I would like to know about your childhood. How growing up in Hyderabad looked for Dr. Akash.
Okay, so I would say growing up in Hyderabad was one of the most amazing experiences of my life, I would say. So it was like all my friends from here since I started residing in this city for about like 20 years now, and
Mhm.
I've stayed here for a long period of time, and I've seen all my friends grow up together, and who are just in other states, and just pursuing their career of their dreams.
Mhm.
And growing up in Hyderabad, I would say one thing is the food that I've mentioned already. So every junction you go, there's a food joint with explosion of flavors, I would say. Just try to eat it, indulge in the magic, and just experience the beauty, I would say.
Ah.
So that was one thing. And Hyderabad is a location for adventurous people, I would say. Just going out to the suburb and just trekking was one of the experience that I had, and just going to the water worlds and the wild waters was one of the hard to go place with my friends I would experience. So those adventurous things were also there. And another thing was like the opportunities in Hyderabad are were always growing.
Mhm.
May it be like the competitions, it was the hub for competitions. So since as I mentioned, I was a soccer player. I had like many tournaments in Hyderabad that I attended, and I just won many prizes.
Mhm.
And coming to arts competitions, so I have a like a huge interest in art, where I just took part in the World Photography Day, World Arts Day, right here in Hyderabad, next to my home, where I was awarded the first prize for it. So it was a wonderful experience staying in Hyderabad, I would say.
Interesting, interesting. So yeah, Dr. Kash, you have given me a lot of information about you, and that's very interesting.
Thank you so much.
So I want to ask you, like, what attributes of the U.S. healthcare system you like?
So I would say like US healthcare system is the advanced medical system that everyone talks about. But particularly to me, I feel like there are a few qualities that I love in the US healthcare system is the advanced medical system as mentioned, and the implementation of the ever evolving guidelines to deliver the best patient care possible. So that is one point that aligns with my aspirations. And the other one is the balanced curriculum. So a resident is given about a stipulated number of cases that he has to go through a day, which will actually increase the efficiency and the quality of the patient care, which I look up to in the future. And the other one would be a well-tailored systemic approach to get into a perfect diagnosis. So wherever you just want to go, you just have a flow chart of items to just keep your checkpoints through and attain a particular diagnosis. So even though if you're just not particular with the diagnosis, going through this pathway will actually help you gain a lot of knowledge onto it. And the other one is the collegial work environment, I would say. Like wherever I just visited during my clinical rotations, the physicians and the residents were so friendly, and they made me just feel like had made me feel like family. So I guess just this would bring out the optimal functioning of a resident, I believe.
That's very interesting. That's very interesting.
Thank you.
So if I now I have a scenario for you. If you have to be a cookie,
I'm sorry, may I beg your pardon?
if you have to be a cookie,
Okay.
understand? How would that be? And how can you can relate to that cookie? Yeah.
Okay, I would say first initially being a cookie would be the most I would say the best thing, because it, even though it gives you diabetes, people are just fighting for you. And I guess I would be the most favorite item for girls, I would say. So so being a cookie would be like no one wants to share with you, and everyone wants you for themselves, I would say.
Oh,
Face
interesting.
at the same time, and you're just lethal at the same time, but everyone wants. I guess that would be an amazing opportunity.
Nice, nice, nice. That's very interesting to hear. So yeah, now you want to be part of the US healthcare system, but you told that you have your parents back home, your brother. So how would you deal with that when you miss with them and you're working in US? How would you deal with that? Do you have you considered reconsidered your decision moving to US because you are going to lose a big part back home?
Yes, I did have these thoughts, and sometimes I did procrastinate over these thoughts as well. But I felt whatever I need to serve back to my country as well as my family, I guess I would be able to serve this after being shaped into a wonderful physician. And I guess US is the ground for that. So
Mhm.
I would say for the development of my brother in this aspect as well, because of his autism and everything, US is also doing a lot of research into this, and I wish to learn all these things possible so as to give the best care possible to my brother. So I guess that would be a sacrifice that I would make to make my family happier.
That's interesting. So, Dr. Akash, you will get a chance to be part of a residency program, and you might have to practice after that in the U.S. healthcare system. Suppose you're running your clinic, and your clinic, some patient comes to you who has a bad experience with the healthcare system, or they don't trust the healthcare system. How would you handle that patient, and how would you handle that patient? Yeah.
First of all, I would say patients do go through their own battle because since it is their own illness, they wish to get the optimal care possible and all the attention in the world. I really understand this aspect, and if a patient does approach me in the same way, I would be happy to listen to his part of the story and make him understand, make him understand what exactly went wrong and what will actually work for it. So do people do just come with, I mean, patients do come with a lot of complex medical issues. So I would, the first thing I would make sure is does the patient understand appropriately about his own medical condition? So that is the one thing that I would do. And the second thing, I would reassure with all my will, saying even though he's my patient, I would just treat him as my own brother or else my own family, because I have been through a lot, and the physicians who have been on the other side of the table when I was the patient, they made sure they reassured me, and as I told, those magical feelings of astonishment. So those feelings, I will make sure the patient has them, and I'll work closely with him. So saying like I'll just work as a team, make sure here all his issues are resolved one at a time, and I'll make sure everything is addressed.
Okay, perfect, perfect, interesting. So, life is an experience of high and low points for sure, right? So you must have low points in your life as well. Just talk of, for instance, which is the lowest point in your life and how you dealt with that.
So on a really bad note, I would say during the COVID pandemic, during the second wave, I just lost my grandmother to the grasp of COVID-19, and it was the I would say it was the lowest point of my life. So academically as well. So at that point of time, I had to take a break during my internship, and look after my family because. It was really stressful situation, and at the meantime it was very tough because we couldn't even do the last rituals of my grandmother. So that was very heart touching, I would say, and that was the lowest point of my life. But one thing what actually just propelled me through this phase of my life would be her words of wisdom, my
Mhm.
grandma's words of wisdom. I remember, I still, when I just close my eyes, I can just remember me standing at her bedside and she just praying for me, saying, "You would be the best doctor," I would say. So those were the magical words, I would say. Even though if I would say, even though it's all reciting, "I love you," those wouldn't sound this magical. What my grandmother said, "Be the best doctor ever." So
Mhm.
this is my constant source of motivation which keeps me going, and the lessons of the empathy and the passion that I carry. So I guess I will just deliver all this to whichever patient I encounter.
Perfect. So I'm so sorry, first of all, Dr. Akash, about your loss of your grandmother, but how you overcome that situation, that's really commendable and appreciated.
Thank you so much.
So now we're coming to the end of the interview. I would just like to ask you if you have any questions for me to answer.
Yeah, sure, sure, Dr. Aishman. So one thing I would ask is like, so how if there is a, I would say, what is the best strength of your program, and what is the best what is the weakness of your program, and how would you like make sure a resident is not affected by any of these?
Oh, sure. So the biggest strength of my program is that we take the resident feedback very seriously. So every month we do have the resident feedback meets where the residents like they can discuss like whatever the issues have. We take those things very seriously and do try our best to shape up our program so that it suits best to our residents.
Okay.
There's no weakness as such, but yeah, we are open to any new suggestions that we can add to our program and take our program to the new heights, because I feel nothing in this world is perfect. So we are open to any kind of suggestions that can take our program to the new heights.
Yeah. Thank you so much for the clarification and everything. And I would love to be a part of your team and just to make sure I contribute as much as I can
Mhm.
and learn as much as I can and contribute as well.
Sure, sure. I wish you all the best, Dr. Akash. I hope that wherever you're this time, you get matched over there and be part of the US healthcare system. Wishing you all the best for the future. And it was a pleasure talking to you. Mhm.
Yeah, thank you so much, Dr. Aishwan.
Perfect. So yeah, it was a very good interview. You have a very good command over the English language for sure. Like you speak very fluently,
Oh,
right?
thank you so much.
But since you told it was your first mock interview, so you have to structure your tell me about yourself because it went on for 3 to 4 minutes,
Okay.
right? So you have a lot to mention over there about Hyderabad, your interest in sports. Like you mentioned, your brother is suffering, has autism as well.
Yeah.
But is he a doctor?
No, he's not a doctor. He's just pursuing his plus one right now. So
Mhm.
it's been like a tough journey for him going through all this.
I'm sorry about that. Yeah. So it's like you can talk about that, but just avoid, mentioning about why you wanted to be a doctor and tell me about yourself,
Okay.
right? Because
Yeah.
you just have to even keep the lead. You can just mention my brother is suffering for autism, and that inspired me to become a doctor.
Okay. I can just cut short.
Just a line you can just so that I have more questions to ask you, right? Because when you
Yeah.
mention why I wanted to be a doctor, why would I ask you that question?
Yeah.
Right? So yeah,
Yeah.
otherwise tell me about yourself was very good. But yeah, for the other questions I asked you, like growing up in Hyderabad, you could concise in a better way. Like, I got a chance, I was studying in this school, then I did my medical school, which was this many hours away. Then you could talk
Oh, yeah.
about 1 to 2 specialities of Hyderabad, right?
That was very spontaneous. I guess just a
Okay, that's fine.
quick
That's fine.
weird answer. Yeah.
You can just prepare. Now you have a question, somebody can ask you. Like, I belong to
Mhm.
Jammu, somebody can ask me, tell me about you growing up in Jammu.
Yeah.
Right? So that's
Exactly.
good. Like you told in the Hyderabad, you could just describe about it a little bit. Then what I can say is like it was a city. In the heart of the city was this hospital. I always dreamt of going there. So I worked like during my medical, like 11th and 12th standard to go into that institution. And luckily, I was very lucky enough to get an opportunity. Like something like this. Like I belong to a city. We can just work on our answers. Now we know the question.
Yeah. Yeah.
Have to work on that.
Thank you so much for that question. I really appreciate it.
So then I asked you about why US healthcare system. Yeah. So you can just, talking about that, you can start about your background that I got a chance to rotate at these many places for these many months, right?
Okay.
From that, what I like with US healthcare system is one, two, three,
Okay. Yeah.
right? Like one, two, and three. Like you can just have three solid points instead of having just one. With
Okay.
multiple points, you can have three solid points. And there can be a counter question when you tell about the research thing that you don't follow the research back in your home country. That can be again a counter question, and you can just because that's what I ask during my mocks to the people because I want to know their perspectives, right?
Sure.
So somebody like one of my friends told that since India is this is a very populous country, so any resident or doctor has to go through many patients in a limited period of time, so they don't have
Mhm.
time to review the literatures. So they
Yeah.
have to take their decision based on a clinical judgment or a set guidelines by the hospital. or that workplace, right? One
Yeah.
told this, the other person, yesterday gave a very good answer that in India, there are a lot of people, the health literacy is not that much. So at first, you have to convince the patient to think about their health, to seek a medical help, right?
Oh,
So it's very, so at that point of time, we cannot tell about them about the new advancements that are happening, and plus they cannot afford most of these treatments. So we have to give them the treatment with whatever available options we have.
yeah.
So that are the two perspectives that I got from like people. But yeah, you can even use that in your answer. You can ask like whatever questions you feel that they're difficult during a mock. You can ask the other person about those questions.
Yeah, sure.
Otherwise, your answers were very, very good. They weren't bad from any angle. But the cookie thing, like, that yesterday only somebody asked me, so that's
Oh,
what
yeah.
I asked you. So what I gave as an answer was, but I even liked your answer that how interesting is a cookie,
Okay, yeah.
right? And that, it's a girl, like it's a favorite of girls. So yeah, like, something like this, and everybody wants it as a complete, right? So
Yeah.
that's again, like what I answered was that I want my cookie to be a multigrain one because I advocate for a healthy lifestyle, right? And
Uh-huh.
second, I would like to have more of nuts to it, right? So that it becomes more crunchy and more tasty and add flavors to the cookie because I feel that I'm a person wherever I go, I spread happiness, more energy in that area, and I just lighten the mood. So that was
That's
my
actually a
but
very good answer, I would say.
that was my answer. I was very spontaneous again, but even I
Yeah.
liked your answer very much.
I would say I just went in the people's perspective. Only the thing that I had in mind was a chocolate chip cookie.
That's fine. See, that answer is not wrong at the end of
Yeah,
the day, right? That answer
sure.
is not wrong at the end of the day. But yeah, you can just work more on you can practice every day to improve, right? Nobody is
Yes,
perfect, but yeah, I
absolutely.
liked your answers and I liked your confidence as well. Like you're
Sure. Thank you
fluent in
so much for
the
that.
language and everything. So you can just work. See, it's your first mock, and it was my like fifth or sixth mock. But I feel we were at the same level. So that means you are starting it from like really high point. Like you are very
Oh
well,
my God. Okay.
right? So you
Thank
can
you
just
so much.
improve. You can just improve even more so that they can rank you even higher, right?
Yeah, then Ayushman, thank you so much. I guess this was a really great opportunity. I mean, just making up this platform, I guess there are many other agencies charging hundreds of bucks for this. And I really appreciate your effort, man. Seriously.
I don't feel like honestly, I didn't have anything in this mind, but that's what I'm learning. So I just conduct my sessions. I thought that switch it to let's one-on-one mock interviews, right? Because that's how like we can have a continuous practice. Otherwise, the time is tough for everyone. We're just waiting for a mail to get an interview invite, right? Everybody is doing that. People are
Yes.
sending text every how many interviews you got, and it's very depressing at the end of the day, right? So I was like, at least through this platform, I can, for me at least, I can have a confidence prep, right? First, I'll think
Yeah.
about myself, but if it's helping you people out, then I'm very happy about that, right? But for me
Okay,
to have
everyone's
a
on the same platform. Everyone's in the same platform, just waiting for the interviews. I guess once November kicks in, everyone is surely gonna get the invite.
absolute, I think like yeah, next like do I like it's a Sunday over there. From tomorrow onwards, people will be getting invites for sure.
Yes, yes. And
Because
absolutely. And whoever is in the group and whoever is in the the meeting room, I would say, just hang in there. You have just made it to the final stretch, I would say. It's the time for
absolutely,
the home run.
let's be proud
So,
of ourselves that we reached this point because it's not easy, right?
yes.
Due to
Yes.
so much stress and reaching this point is like we have achieved a lot, and I am hopeful that like God will be kind to all of us, and we'll one day
Yeah.
achieve whatever we want to, right?
And if someone even says if everyone understands Hindi in this meeting group, I would say this is everything by hat ka khel. So I would say interview is your left-handed game. So just ace it. Uh,
Mm-hmm.
it's going to be done because you have been through a lot, just going through rotation,
Absolutely,
step one,
absolutely.
step two prep, and whatnot, step three, and everything.
Mhm.
So I guess, yeah.
Right. So I just
Okay.
leave the meeting room and I'm like, after some time, I'll leave the other. You could just continue with one-on-one mock with each other, right? You can just use this opportunity, like try to get at least one or two mocks every day. So that's how you're going to learn, right? There's no
Sure.
specific day that you have to start with doing the preparation. Just start it today, right? And after 5 to 6 days, you'll see the change in the confidence you have,
Perfectly. Yeah.
right?
I guess we'll just be coming up with new answers as well. So we can
Mm-hmm.
just refine our answers.
Absolutely. Like your answers are perfect, but yeah, they need to be refined. Like my answers, I feel are good, but I that like we are told that my answers are very long. I have to work on that. Like that would be more with the practice. We just make answers long because we don't have that much practice with that answer, right? The more I
Yeah.
practice that answer, it will be like more refined and comparatively shorter.
Yeah.
Mhm.
And guys, if there is any feedback, it's much more appreciated for whatever the answers I've spoken. And yeah, please, if there
So
any
I'll just take a leave, and you can just like you can give a feedback to Dr. Akash, and after that you can have even a one-on-one mock with each other, right?
yeah.
So thank you
Okay.
so much. I'll just take a leave. I'll just drink some water, and maybe I can get a second mock done as well. Thank you so much, Akash. It was
Yeah. Thank
pleasure
you so much.
getting interviewed by you. Thank you so much.
Yeah. Bye.